Now I am talking about this Pnst, prickling neurostimulation technique, right? What technique is it? The Japanese doctor, his name is Hiroshi Nagata. Hiroshi Nagata, who is the medical doctor who invented this therapy to be known as a Pnst treatment. Can we do the magic in this? But certainly we can do it, but the most of the diseases can be sensitive to treat by using this Pnst method also. That's called as a prickling. Prickling means is the pricking. Neuro means the nerve fiber. Stimulation is the activation. Technique to be known as a treatment. So that how do you do it? For instance, the patient is complaining, I do have the pain on the, start with the head itself. Head region, I do have the specific region of the head having the pain. So that particular time, you try to analyze which pathway having the pain, which area having the pain, which meridian having the pain. Then you just assume the point to be known as a, on the temporal region I do have the pain. The most of the pains are the temporal region, not on the parietal region, not on the vertex of the head region. Of course, sometimes we'll get on the occipital region. We will select on the temporal region. Please come on, gentlemen. So now I just select. You should go to the salon now, okay? Okay? Then you should come to next week with the baldness, right? So now you can have a look when there is the pain on the cervical, this the temporal region. So that time you just select the entire area. That for example around 1 rupee coin, select the center of that area. This area having the pain, but I selected the center point. So by using the not the sharp one, but the other side. The sharp one we do this type, right? So then turn it, then invert this stick, then you just apply the pressure on that specific region. Give the pressure in the central region that will be known as a center point of the affected area. Then you just move on to the second region. There is the top. You go to the top, then come downwards direction. How there is a spiral motion. That is a pen. Use it. So spiral motion. You look into the pyramid. Did you visited anyone? The pyramid. On the pyramid, you can find there is a spiral motion. For example, the patient is complaining, I do have the pain. This is the entire region. I do have the pain in this region, for example. Now, just you select the center point. Just you select the center point. Once you hold it for a few seconds and then leave it and then give the pressure. It's not that deep pressure that toothpick goes inside. It's not like that. But just mild to moderate, give the pressure on the specific region that you are activating to that entire region. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You just activate at least 3 cycles at a time. One cycle is completed, another one more cycle. Likewise, you just activate on the specific region. That will be really helpful. How does it work really? Wherever having the pain, for example, now the pain is in this region, on the elbow pain is there, especially on the tennis elbow. There is a pain on the lateral epicondyle of the humerus having the pain. On that region, how you need to be activated. This is the center point, this entire region, make it as a center spot. So now this is the center spot having the pain. This is the entire region, this is the center. Now you just activate likewise. So in this way, you just give the pressure You need not to do. You just show to the patient. Let they do on themselves. You just give the pressure 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Likewise, we need this to be known as a one cycle. Very closer place you just do it. This to be known as a one cycle. If you do it repeatedly at least 3 times in a day, morning 3 times, evening 3 times, you spend at least 3 times in a day, certainly the patient feel lot of changes, because this area got the stagnation of the chi and then stagnation of the blood, or the insufficient of the energy, insufficient of the blood. Both are chances are there to cause us the problem. That condition, once you keep activating this system, this certainly will get changes slowly, and that particular area started moving the chi on that region. If the chi is not ascending to that particular region, not reaching, then started moving the chi to that level. If the chi got stagnated, then the chi started moving from that place to the different direction. Then at the same time, of course, there is the inflammation is there, infection is there due to trauma or injury. That time it's not advisable to apply on that region. Use on the outer region, not on the same region. Go to the other region, do it vicinity of that area, but not on the affected area. Right, in this way you just activate. This will be really helpful for the pain-free treatment without using the analgesic, without using any non-steroidal anti-inflammatory drugs. The patient feel lot of changes. This called as a Pnst. But however, there is a numerous points are there. We do have one Jimyar applicator that's called as a Pnst tool. Pnst tool, where we apply on the nail basis. Initially it is advisable to apply on the Jingwell points or the Putial points. You just activate all the points in 1 second. How many seconds?
1 second.
That is a sharp objective. That's the reason you cannot apply to the deeper level. Apply superficially and then leave it. Apply superficially and then leave it on the all the putial points. That would be really good to initially start up the Pnst treatment. That, however, that I'll teach you from where to where it starts. But in generally, what is advisable, whenever the patient comes to you, rather than using the needle, I told you 2 techniques. So today you are taking the 2 techniques to your home. That to be known as a one technique to be known as a acupressure. I told you the second technique to be known as a Pnst, prickling neurostimulation technique. This to be given the chance to the patient in order to heal himself or somebody the where, for example, back pain is there, back cannot do the patient, better wife is advisable to activate some of the points, ask them to come with the attender, show to 1 time to the attender, then they will follow that particular area, keep activating by using the technique, right? In this way, certainly will be useful by using the Pnst method. This is not the my method. This is the medical doctor who studied the acupuncture also. Then he invented, rather than using the needle, but wood. Do you know the elements? Fire, earth, air, water and wood. Wood is divine as a sky, space, ether. All the things are, qualities are to them. So therefore wood also having the medicinal properties to treat for the numerous diseases. That's the reason wood also element. Consider element you are treating here. You wanted to use the metal also as an element. Use, that's the reason the Professor Park Jawu started using as a metal object as Jimyar applicator also advisable to treat any kind of the illness by using that. And also these needles to be known as a copper needles, also having the more electrical conductivity. When the person wanted to become as a electro-acupuncturist, electrical acupuncturist or the electro-acupuncturist, or the name itself is acupuncturist, neuro-acupuncturist. Something is some designation you can take it, but here also Pnst practitioner. We can bring down to the each and every home should have one doctor, that to be known as a natural doctor. One woman having doctor or one men having the doctor at home. At least एक बहू घर में. Actually, I remember Sunil Nihar, who is from Maharashtra, and he said me, हर एक घर में एक बहू एक बेटी डॉक्टर बनना चाहिए. एक बहू, that means is the daughter-in-law, the other one is the daughter, should have the one doctor at the one family. So therefore, even with that slogan, even I wanted to tell you this word, every home, that girl and then daughter-in-law, both should have the doctors at home.